Hi friends, today we are going to discuss about basic life support, that is BLS, and advanced cardiac life support in cardiac arrest, in a cardiac arrest scenario. Okay, so starting with BLS, basic life support. So when you are seeing a patient is unresponsive, the first step you have to give the basic life support to that patient, and the first step of BLS is scene safety. Verify scene safety. The scene should be safe, otherwise the rescuer may become the victim, and the patient should be placed into a safe place. Suppose if a patient become unresponsive in the middle of the road, you have to place him to the roadside. If the patient is in a lift is again an unsafe place, so make him lie down in a floor. So first step is verify scene safety. After verifying scene safety, you have to check for the responsiveness. Okay, so second step is check for responsiveness. How will you check for the responsiveness? You can tap the victim's shoulder and shout like, "Are you okay?" If the patient is not responding, the third step is nothing but call for help. Call for help. You can call for help in different ways. If you are inside a hospital, you can activate specific hospital codes to get an AED. And if you are outside the hospital or workplace, you can call in the emergency number. The ultimate aim is you should get an AED or defibrillator. Okay. And the fourth step, once you activated the emergency medical service or call for help has already done, then the fourth step is check for the pulse, and simultaneously scan for spontaneous breathing. Scan for breathing movements. You should check for the pulse at the central arteries, like your carotid or a femoral artery, at least for 5 seconds. But not more than 10 seconds. Okay, simultaneously you should scan for breathing movement. So after this step, you can have 3 different conditions, like you got a normal breathing and a normal pulse. So in this situation, you have to do nothing, just monitor the patient until emergency team arrives. Monitor the patient. The second scenario, you have normal pulse, but no breathing. In that scenario, you have to provide rescue breathing. How to give rescue breathing? You have to give one breath in every 5 to 6 seconds. Okay, so it will give you a respiratory rate of around 10 to 12 breaths per minute. Okay, that is the second scenario. And the third scenario is no pulse and no breathing. In this case, you have to go for chest compression, CPR, cardiopulmonary resuscitation. Okay, so you have to continue the CPR until the emergency response team arrives. So once you get an AED, and once you get an AED, the scenario changes into our ACLS. Okay, here the BLS ends and ACLS begins. So let's go to the ACLS part. Advanced cardiac life support. So in ACLS, the CPR is ongoing, AED has arrived, so attach the AED or defibrillator. Okay, once you attach the AED on the victim, you should assess for the rhythm, watch for the rhythm, and look whether it is shockable or not. So the first step is attach the AED, then you should look for rhythm on the monitor, shockable or not. So we have two kind of rhythm, shockable rhythms and non-shockable rhythms. The shockable rhythms are ventricular fibrillation and pulseless VT. So if the rhythm is shockable, yes, then it will be VF or VT. And if the rhythm is non-shockable, it is either asystole or pulseless electrical activity. These are the four rhythms that you can see in a case of cardiac arrest. Okay, so first we are discussing about the shockable rhythms, then we will move on to the non-shockable rhythms. So we find a shockable rhythm, VF or pulseless VT. Then immediately we have to charge the defibrillator and give shock. The joules for shocking is different in different type of defibrillator. You have monophasic and biphasic defibrillator. Okay, in case of a biphasic, you have to in any device you have to shock with the maximum available joules. So in case of a biphasic defibrillator, the maximum joule or recommended joules for shocking or defibrillation is 360 joules. Sorry, it is 200 joules in case of a biphasic. In case of biphasic, it is 200 joules. In case of a monophasic defibrillator, it is 360 joules. Okay, that is our third step. And immediately after delivering the shock, you have to resume your CPR for 2 minutes. You should give uninterrupted CPR for 2 minutes. That's our fourth step. After 2 minutes, again stop CPR, check for the pulse and look the monitor for the rhythm. Again, look for the rhythm, whether it is shockable or not. Okay, now again you find a shockable rhythm. If it is yes, that is the fifth step. You find a shockable rhythm again. You have to give shock. Assuming you are using a biphasic defibrillator at 200 joule. Okay, once you're done with the shock, you have to continue CPR for 2 minutes. Again, you have to continue CPR. If there is no pulse, you have to continue CPR. Here comes the first drug of ACLS. That is our adrenaline or epinephrine. The dose of epinephrine is 1 mg IV. And we have to consider this epinephrine at every 3 to 5 minutes in following part of resuscitation. Okay, so the first drug is epinephrine 1 mg in every 3 to 5 minutes. So that's our sixth step. Okay, again after 2 minutes we have to stop the CPR. look for the pulse. There is no pulse. Then look to the monitor for the rhythm. Again, we are getting a shockable rhythm. Assume we check the rhythm and we are getting, yes, it is a shockable rhythm. Then we should give shock again at 200 joules in a biphasic defibrillator. Okay, that's our 7th step. We have given the shock. Now, after the 3rd shock, we have defibrillated the patient 3 times with the 200 joules. After our 3rd shock, of course, you have to continue your CPR for 2 minutes. But here comes our 2nd drug. First drug was adrenaline or epinephrine, and here comes our 2nd drug. Either injection amiodarone or lidocaine. You can use either of the drug based on the availability. No preference. You can use amiodarone or lidocaine and continue the CPR. Okay, that is our 8th step. Again, if you are after 2 minutes, you have to look for the rhythm, pulse, etc. And if you are getting a shockable rhythm, you have to repeat the cycle. Again, the next drug you have to give is our epinephrine. So, like this, you have to give. Come back to the previous step. That's our 5th step. Assess the rhythm. If it is shockable, give shock and adrenaline, continue CPR. Like that, you have to repeat the cycle until you get pulse or you stop the resuscitation. Okay. But if between, after giving the first shock, the next second time you are getting a non-shockable rhythm. So we have to look for the protocol of non-shockable rhythm. That is our asystole or pulseless electrical activity. Immediately after attaching the defibrillator, you are seeing a asystole or pulseless electrical activity. You have to load your drug adrenaline, injection adrenaline immediately, as early as possible. You have to load the drug adrenaline as early as possible. And you have to go on with that's our 9th step. You have to go on with your CPR for 2 minutes. And again, here also you have to consider drug injection adrenaline or epinephrine 1 mg IV in every 3 to 5 minutes. Okay. Suppose if you are getting a shockable rhythm in between, you are looking for the rhythm after 2 minutes, whether it is shockable. Yes, you are getting a shockable rhythm. Yes, it is shockable. Then you have to go to the step number 5 or 7. Then follow the algorithm for shockable rhythm. But you are not getting, it is not a shockable rhythm. No, it is not a shockable rhythm. Then nothing but resume CPR for 2 minutes. Okay, again watch for rhythm. It is shockable or not. Yes. If it is yes, go to step 5 or 7. If it is no, you have to continue until ROSC. Okay. If it is no in the further cycles also, continue cardiopulmonary resuscitation until you are getting a return of spontaneous circulation. Okay, so that is our end of the non-shockable rhythm management. This step has to be followed if you are not getting a shockable rhythm here also. No shockable rhythm. Then also you have to go. This is our 9th step and this is our 10th step. This is our 11th step and this is our 12th step. So if you are not getting a shockable rhythm here, you have to go for step 12. Okay, here also if the rhythm is non-shockable, previously it was shockable, now it is, if it is become non-shockable, go to step 12. Okay, little bit confusing, but you have to, if you are following from the beginning in the in a particular order I have written, you can easily understand the ACLS algorithm. Okay, so this is how you have to resuscitate a patient once you get a defibrillator. Now few points about how to deliver CPR. So how can you give a good quality CPR? The first rule is push hard and push fast. Push hard and push fast. So hard means the depth of CPR should be at least, in case of an adult cardiac arrest, it should be at least 2 inches or 5 centimeter in depth, and give CPR at a rate of 100 to 120 per minute. Okay, and the second point is minimize interruptions in between, in compressions. Minimize interruptions in between the compressions. And third step is, during, you have to ventilate the patient at a ratio of 30:2. After 30 compressions you have to stop and give 2 ventilations, but do not or avoid excessive ventilation. Okay, and for a good quality CPR, change the compressor in every 2 minutes, or if the manpower is limited, you have to change the compressor if one get fatigued. Okay, and you can use capnography. To assess the quality of CPR. Persistently below 10 mmHg of EtCO2 in the capnography is showing a poor quality CPR. So these are the features of a good quality CPR. Now, regarding the shock delivery, I have already told, in biphasic defibrillator, the joule is, regarding the shock, in biphasic defibrillator, it is 200 joule, and in monophasic, it is 360 joules. It is for defibrillation. The cardio version, the joules are different for different rhythms. It will discuss in a separate topic. Okay. Regarding the drugs used in ACLS, we have seen 3 drugs in ACLS. First drug is epinephrine. First one is epinephrine or adrenaline, also called adrenaline. The dose is 1 mg. Okay, 1 mg IV, or can be given as intraosseous also, and it has to be repeated in every 3 to 5 minutes. The second drug after third shock is amiodarone. And the dose is, it is given IV or IO. The dose is when we are giving amiodarone first time after the third shock, the first dose is 300 mg, and the further doses in the further steps or second or further dose is 150 mg. If the amiodarone is not available, or we are using lidocaine instead of amiodarone, lidocaine IV or IO, the first dose, here also there is a loading dose and further doses. The first dose is 1 to 1.5 mg per kg, and the second dose is 0.5 to 0.75 mg per kg. Make a note, it is here it is a mg per kg, not mg. First dose is 1 to 1.5 and the second dose is just half of that, 0.5 to 0.75 mg per kg. Okay. Then there are certain reversible causes for cardiac arrest. You have to consider that causes also during the resuscitation, and if any of the cause has identified, you have to correct the cause also. So what are the reversible causes of cardiac arrest? Reversible causes of cardiac arrest. There is a mnemonic like 5 H's and 5 T's in cardiac arrest. The H's are, reversible causes are hypovolemia, hypoxia, hydrogen ion, H plus ion, that is our acidosis, hypothermia, and our hypo or hyperkalemia. These are the 5 H's of reversible causes, and the 5 T's are tension pneumothorax, and toxins. Third D is tamponade, like our cardiac tamponade. Fourth one is thrombosis. It is for pulmonary thrombosis. Fifth one is also thrombosis. Here it is coronary thrombosis, ACS. Okay, these are the reversible causes of cardiac arrest. And what are the signs of return of spontaneous circulation? You are resuscitating a patient according to ACLS guidelines. So how will you, how you should know the patient has got a pulse or the return of spontaneous circulation has achieved? So the signs of return of spontaneous circulation. If you get a palpable pulse, then it is the ROSC has achieved. Or if there is a BP in the monitor and abrupt increase in EtCO2, like typically more than or equal to 40 mmHg. Okay, and also if you are inserted a arterial cannulation and the monitor is showing spontaneous pressure waves, okay, spontaneous arterial pressure waves in the monitor. These are the signs of return of spontaneous circulation during CPR. Okay, so that's for the day. Thank you.